So the first technique we're going to do is going to be contralateral side bending and flexion. The reason that we've chosen flexion is because in this case it's the right side. You always put the joint that you're treating up towards the ceiling. Okay? So on this right side, when she tries to side bend left, the right joint won't go up. And remember, this is flexion, this is extension. So left side bending is this. So that's her problem. She can't left side bend, and it's because the right joint won't flex. So we've marked our level. This is a painless hypomobility, so we're going to go ahead and position and lock into the segment that we're interested in treating. I'm going to go ahead and flex her up to and into my segment. And then what I'm going to say to her is straighten your top leg out, straighten, 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 and I kind of help her out a little bit. And you can see her pelvis tilt and her spine contralaterally side bend. I'm going to say we're going to just leave you right there. I do my neutral rotation lock from above. Now, it's important to maintain the contralateral side bending from below. So all you're going to do is just take this hand and hold her pelvis in contralateral side bending and say, now what I need you to do is straighten this leg out. And I kept her in contralateral side bending. Did you see how I did that? And now I can rotate her, locking her from below up to and into the segment that I'm interested in treating. To perform my mobilization, we've got two vectors of force here now. We've got flexion, which was this direction, and we've got side bending, which is this direction. So for all intensive purposes, flexion is along this vector, side bending is along that vector. So the way that I'm going to do a combined force is to split the two vectors in the middle by 45 degrees. So when I go to apply my mobilization to flexor and contralaterally side bending, I'm going to be, my force is going to be pretty much going down the shaft of her femur in this position. Again, I'm going to log roll her towards me. I'm going to get down in this position. Actually, for this technique, I would prefer to be here. And as I do this then, and I push this way, that is flexing her and contralaterally side bending her. I do not need to do anything with my hands here. If you want to, you can, stabilize, but all I need to do is this. And what I would have her do as a muscle-assisted technique is I could say to her, let's have you go ahead and push your your right shoulder into the table. Push. 1, 2, 3, 4, 5. Relax. Take up the slack. Push. 1, 2, 3, 4, 5. Relax. Take up the slack. Okay? Everybody good with this technique? This technique works beautifully with your stenotic patients because it really opens up the foramen. They will love this technique. Okay?